How did you first hear about me?
I heard about you from a friend of ours, Annie Niemeyer. Her husband had come in and had some work done with the Shockwave on his forearm, I believe. And the story kind of goes, I'm a competitive archer and I developed tennis elbow and golfer's elbow. And I was having a high level of pain and weakness. And another acquaintance of ours had said that I should do shockwave therapy. And I said, I don't know anybody that does shockwave therapy. And Annie, my friend, jumped in and said, I know somebody. And that's you. And that's how I came here. Yeah.
Okay, so that's right. That was Ray. I treated him for that type of problem because Ray is also into competitive
Archery as well, yes.
Right. And can you give me a little bit of an idea of what kind of symptoms you had before we started to treat you?
Okay. I had quite a bit of pain and I couldn't grasp anything. I was very weak. I would always have to hold something up with both hands. Those are probably the biggest things. When I would draw my bow, it would be just everything I could possibly do to draw that bow. But my biggest challenge was the amount of pain that was involved when I tried to use the elbow or flex the arm or grasp anything.
And did you use the elbow a lot in the archery, or was that in other activities as well?
It would be both. I mean, just day-to-day life, I was struggling to pick up a cup of coffee.
Was it painful to pick it up and weak also? Okay. And did you find anything to give you relief beforehand?
I used that strap. I forget what it's called.
The tensor
and
band.
I would use anti-inflammatories and pain medication. And I started using that kinesiology tape.
Yep.
That would help keep things together, and combination of all of that was helped me get through my summer competitive archery season.
But they obviously didn't resolve the problem. They were sort of a temporary patch or crutch or something like that.
That's exactly right. They helped alleviate some of the pain and allowed me to function.
Okay. So then we started doing the shockwave treatment. And I think for the first little while, of course, like most people, you didn't feel a whole lot of change for the first several treatments. And then it started to notice some gradual improvement. And now we've gone through a substantial treatment package, which I think is the best way to do it. And how are things better now?
I can't believe the difference. I'm true. This is, I think we were about halfway through the package, and the golfer's elbow had pretty much disappeared. And that was what I really talked about at the beginning. And I'm going to say in the last 3, I really started to notice a difference well, I always noticed a difference in the tennis elbow, but it was just in the last 3 that I thought, even if that's as far as it went, I could live with that. And since my last treatment, I've been pushing and prodding, and it's even better than it was last week.
Oh, really?
So I'm feeling pretty good about, and the strength is coming back, and I can squeeze a little tennis ball without that horrible pain.
And do you have to use the tensor band and creams and all that stuff now? Or?
I haven't shot my bow for too much over the last few months on the advice of you.
Yes, because we wanted to make sure that we do everything we can to heal it.
Yeah. I'm truthful though. I did shoot it a few times, and the last time I shot it was for Lethbridge Sport Council, and it actually was worse. I tried it with the band and I didn't like it. I took it off and I could pull my bow without the same pain that I had before.
Oh,
and
excellent.
now that we're done, I'm starting to shoot again.
Okay.
So far so good.
Great. And for the viewers that are watching, they don't know this, but you're going to be representing Canada next year in like a world competition, right?
Yep.
What is the name of that?
It's for the World Federation of Archers, and I've qualified to be the top qualifying female compound archer on our Canadian team to participate in the 3D World Championships
Great.
in Italy.
In Italy. So,
In Italy.
Yeah, that's great. So this is not just like something you do now and then. When you're out doing archery, you're doing it a lot. You're using your arm a lot. The problem was brought on from probably overuse, and the results are better than you expected, and you'll be able to go on and do a lot of this without any pain to speak of.
I hope so. I believe it. I have a lot of confidence. It's in the 2 months or 2.5 months since we started. It's just a night and day difference. I'm excited about shooting this winter without pain.
Yeah, that's a great thing to look forward to.
Mm-hmm.
All right, so thanks a lot for taking the time to talk to us, and I really appreciate that, and we're going to be cheering for you for next year.
Thank you.